Life in the time of coronavirus means crisis on top of crisis for millions of Americans who have lost their jobs and incomes, which leaves them worrying about how they can afford food, if they can find food on the shelves of our markets, while they worry about the possibility of actually catching this deadly virus. The economic shutdown has dramatically increased the lines of food pantries around the country. 10,000 people lined up in San Antonio. Southern California, to thousands of long lines in Southern California, to thousands of cars lined up in Pittsburgh, Pennsylvania. We all know that the unemployment application filings have dramatically increased and also dramatically understate how many people have lost their income and their jobs so far, since the states have been overwhelmed with those unemployment applications. A more realistic picture is drawn in a new Monmouth survey that finds that 4 in 10 Americans have lost income as a result of the pandemic. In that same survey, more than half of Americans say they are having trouble finding certain items in stores. Toilet paper and hand sanitizer are at the top of that scarcity list. But the scarcity list also contains certain food items now. And so tonight, more people are worried about where their next meal or future meals are coming from than ever before. And the delivery of all of our meals now depends on a food supply chain from farmer to supermarket that has never been under more stress. Andrew Zimmern is an award-winning chef, writer, and teacher, and the host of the MSNBC limited series, What's Eating America. Andrew, thank you very much for joining us tonight. Let's start with the food supply chain and what's happening. We're reading about farmers dumping crops, dumping products. What is happening in the supply chain?
Yeah, we've gone in a short matter of weeks, Lawrence, from the shame of seeing those that could afford to buy food and eat, depleting the shelves in our supermarkets, to talking about if there was enough food. A few weeks ago, I was on air saying there was enough food in the supply chain, but the first cracks would be distribution based. And we started to see that last week. You shut down restaurants, you shut down schools, and the traditional pathway for a lot of those trucks from the wholesaler and warehouses now has to be rerouted to the places where people are actually picking up food, the grocery store, the community resource kitchen, or some other public or private space which is doing community resource work, allowing people to pick up goods. But remember, this is a healthcare crisis we're in. And, you know, I talked a couple weeks ago on the shows about the healthcare cracks that would soon appear. We saw that last week with reports from the farmers themselves that conditions on the farms, in the factories, on the fishing boats, in the crab houses, in the abattoirs, people were not practicing proper physical distancing. They weren't cleaning properly. A lot of workers are living in those places 4 to 6 to a room, taking transportation to and from work as a group. And a lot of us were talking about the fact that if we didn't protect workers in the supply chain, we were in trouble. Well, the reality is that's where we are now, based on the Smithfield processing plant shutting down in South Dakota. That's a hot spot in that state from a coronavirus case total standpoint, right? It's about 40% of the cases in South Dakota are in that plant itself. It's also responsible for 4% of the pork that's sold in the United States. So we do now have a supply chain problem. You were talking with the doctor before about the necessity for testing. We need to be testing and retesting these essential skilled workers, and we needed to have been doing it weeks ago. We need to get those frontline workers and food people, farmers, anyone touching our food in grocery stores, et cetera, people trucking it are essential workers now, and they need to be protected, tested, because their working living conditions are prone to transmit, not mitigate the virus.
Andrew, I've been urged to include people working at our supermarkets as part of the frontline troops who are actually keeping us going through this. I haven't been thinking all the way back in the supply chain to what you just identified. Those are the forgotten heroes of this story.
Yeah, well, we've kept them in the shadows. You know, we talked about this in our premiere episode of What's Eating America. the immigrants and documented, undocumented workers, visaed workers, the people who have been demonized by the administration for the last several years, we've actually disincentivized from going and participating in our healthcare system, even showing up at the emergency room. These are people who, don't have health care. They don't have paid sick leave. They are paying into our tax system. They are essential workers. They are skilled workers. But we've done everything possible to incentivize them from helping out by taking care of themselves at a time where it is essential that we all be taking care of ourselves as a way to take care of the people in our country. I'm really, really worried about the workers in our supply chain. The trucks, we're a capitalist society. The trucks will find their way to the places where it needs to go. Cucumbers will grow again, but we need to have people who are planting the cucumbers. We need to have people who are cutting the chickens in the chicken factories. We need to have people who are taking fish out of the ocean. Without people, it's a very, very simple idea. It goes back 10,000 years. If we don't have people producing the food, we're not going to be able to eat.